is a 39-year-old lady who came in with abdominal pain. And basically, she had this large heterogeneous lesion arising from her uterus. This is kind of like always the debate about whether or not this could be just a weird fibroid versus a leiomyosarcoma, which oftentimes we can't tell. In this case, the patient also had extensive liver metastases. You can't really see them here, but she had a bunch of small round, like these guys here. So we knew that these were probably sarcoma metastases. She dropped her hematocrit and basically started bleeding into her abdomen. And on this CTA study, we could see that there's a huge gonadal vein, and then lots of supply to this area, to the mass, which we think is a leiomyosarcoma. And then there was some high density kind of blood products in the abdomen. We couldn't find the actual source, but basically this is kind of like the case, or even if somebody has some kind of like postpartum hemorrhage, they would basically do a uterine artery embolization. So that's what they did here. Let's see if I can just skip to. Sorry. So they basically go into the internal iliac, and then this is the posterior division, which supplies the gluteal branches, and then they'll go into the anterior division and then try to select. In this case, there were so many hypertrophy vessels here, they couldn't just select the uterine, but they ended up just basically embolizing that entire anterior division. And then they went and did the same thing on the other side. And then this was their kind of post-run. So they put coils in both the uterine artery on the right side and then the anterior division of the internal iliac on the left side. But you can see that this tumor is actually parasitized all these other vessels. So it had parasitized branches of the IMA, of the renal artery, and then it had this huge draining gonadal vein. So basically, they just temporized, decreased the flow to the leiomyosarcoma through this uterine artery coiling. They could have also done like more extensive gel foaming internally, but they were worried that it was because there were so many collaterals that the gel foam would end up going through the collaterals into like the IMA and could then end up getting colonic necrosis. Nellie, I think we lost your video. Oh.
No, I'm here. I just have to, my daughter's, I just didn't want her to interrupt me, so I'm like, turn on another movie.
Oh. So anyway, that was a bleeding leiomyosarcoma. Any comments? This is a really fast one. This was just kind of an interesting one. We had